So back in the 1970s, this strange virus surfaces. We know that it lives in the person's blood. It means fatigue for them, dark urine, jaundice, liver failure. We ended up calling it hepatitis C. And for years, the only treatments were weekly injections, all these pills. The side effects sucked. And those treatments only worked about half the time. Then, 10 years ago, these game-changing drugs arrived. These direct-acting antivirals. This new generation of drugs, way easier on patients. They clear about 95% of Hep C infections. So Canada and members of the World Health Organization got all excited and pledged to wipe out Hep C by 2030. Well, since then, we've become better at diagnosing the virus. But here on the Canadian prairies, new cases are still growing. Hep C has not stopped killing people, especially Indigenous people. Carrielynn Lund and Dr. Alexandra King have seen enough. They're our guests today on Researchers Under the Scope. Hi, I'm your host, Jen Cannell, and we are recording this virtually. It's the 21st of February, and our guests today led a team that created this point-by-point instruction kit for wiping out hepatitis C on the prairies. It's a roadmap on how you hit that 2030 goal. Carrielynn Lund and Dr. Alexandra King are with the Waniska Centre at the University of Saskatchewan. They co-chair the Journeys to Wellness project, and they join us now. Hello, Carrielynn. Hello, Alexandra.
Hi, Jen. Great to be here.
Hi, Jen. Hello, Carrielynn. It's lovely to be here.
And I think just to bring our listeners into the picture here, if looking back at your life and your experience, what would you say it was that pushed you to pay this much attention, to care this deeply about hepatitis C?
Go ahead, Alex.
Okay, you take the next one first. So I was doing my residency in internal medicine and had a very complex patient that I kept on running into in different departments. So you know, spend a month on ICU and so on. And so I kept on running into him, and he had almost every possible complication from hepatitis C, and really was incredibly complex. And eventually we got to the point that there wasn't anything else we could do for him. And so when he was on his way home, he had said to me that, he wanted my word that I would work in hepatitis C so that nobody else would have to go through what he did.
Yeah, and for me, it was on a really personal level. When I was diagnosed, I had been going to this doctor as my primary caregiver for over 10 years. He knew I was a professional. We had great respect for each other. And when I kept getting sick and having pains in my abdomen, and they did testing, and he came back and said, "Oh, so I see you have hepatitis C. Well, you've got a past." And I thought, what? And he said, well, I mean, you can only get that from injection drug use. And I went, no. I knew nothing about it. And I just remember after that my ears were ringing. I was in an internal, shutdown. I was in shock, and I went out of that room and drove home thinking, oh my God, I'm going to die. And I had two small children as a single mom with two small children. And I'm thinking, I don't even know what to do with this. And it was a dark, dirty secret. And I just thought, okay, so I'm going to put things in place. I'm going to line up my life. I'm going to make sure that there's, after death plans for my children. and I'm just going to live the best that I can. And so I started to read up on hepatitis C by myself. Back in those days, we didn't have the same records, electronic records, so that I went to a new doctor and I didn't tell him I'd been diagnosed with hepatitis C. And I just went on a super health diet and, exercise and all of that, and just kept silent about it the whole time. And even though I was in HIV work, and people were talking about hepatitis C and co-infections and all of that, I just was not going to tell anybody that I had been diagnosed, because I didn't want, even my friends and family didn't know that I had been diagnosed with hepatitis C, because I had seen their reaction to when they found out that people had hepatitis C. And so I didn't want my dark secret out. But when Alexandra had this Indigenous research project going, I was invited to participate because she was aware of my diagnosis, whether I'd like to participate as a participant, not as a researcher. And I said okay, and it was the very first time that I'd sat in the circle and that I had the opportunity to share how horrible I felt about myself, how this had affected my life, how I was, locked down in, into this whole thing, not knowing what to do with it, that I felt unclean, that it was just this whole pouring out to people who also had the experience. And it was the first time that I felt that, okay, I think I can go back to the doctor. And this was just when the antivirals had been, made available. I actually went, saw a doctor, got the prescription, took the pills, and decided that no one else should have to go through that. No one should have to feel dirty about themselves and hide this dark secret, not get the best treatment that they could. That the stigma around it needed to be addressed, and I wanted to be a part of that.
Carrielynn, how did you manage to to effectively hide this? Like, it's a pretty serious health condition. How do you manage for so long? Like that had to be more than 20 years.
Well, I come from an athletic background, so I actually went into just being as healthy as I could. Low salt, low fat, low, high vegetables, getting the sleep I needed, making sure I had all of the other checkups that I needed to do, monitoring, having a liver panel, and actually lying to the doctor and saying that I had been taking, Tylenol every day for pain, and that's why my liver enzymes would show higher, because of the medication that I was taking. So no one else even asked me whether or not I should be tested for hepatitis C, because no one considered me to be a person at risk.
And I just got to follow up here too. Why did you trust Alexandra?
Because I highly respect her as an individual, but also as a person, and that I love the work that she's doing. I actually worked for her husband before I met her as his coordinator in research. And so this was someone I felt safe with. And I know that she understood what I was going through. And so it was more on a personal connection and a relationship that I felt safe in, that I was able to say yes.
That brings me to the work that you've been putting together to create this roadmap. And you did. Your team, you held sharing circles and workshops and interviews. And I mean, I'm looking at it. You brought together researchers, health professionals, but most importantly, the people who are actually living with hepatitis C. when you brought them together in these settings, and now we're more into modern times now, right? What were the biggest points that people with that lived experience had for you?
Well, basically, I think the biggest point that people made was the access to services and the stigma and the barriers that were put up for testing, for getting safe, clean needles, and so harm reduction supplies. Just being able to wraparound care is what we call it, where they're at risk for a reason. A lot of people are unstable housed or sleeping rough or not even aware of hepatitis C and the risks, with simple things like, the assumptions were they were people assumed that they injected drugs, but it could have been some other way. And so when people said, okay, so I don't inject drugs, I couldn't have it, they weren't getting tested. They were also really concerned about having safe places to go where they would not have their health status shared with anyone. For instance, here in Edmonton, we have a clinic attached to the hospital that used to be known as the HIV clinic, but now it's just infectious diseases. It can be anything. So you can walk through the door and nobody knows what you're going in for. So there has been some progress, but it's important that people's privacy is protected. And a lot of the environments, picture going up to the desk. What are you here for? Well, I'm here to see Dr. So and so. Well, everybody knows he's the HIV doctor. So there needs to be work done on protecting people's confidentiality and not making the assumptions of their lifestyles and their risk factors. Also, Indigenous people, because of the historic stigma and racism and institutional sterile environment that for a lot of people can remind them or trigger them on the memories of residential school, for instance. There was unethical practices done there, and doctors are not listening. I have stories of my own son-in-law who is not injecting drugs, never hasn't had, alcohol in his back. He had childhood leukemia, and his liver has been affected by the treatments that they gave him. The doctor, when he went in to get his blood tests, the new doctor said, "Well, your liver is high. The enzymes are high. You have to stop drinking. It'll be fine." So just those kind of assumptions we heard from people in the circles that we're judged. We don't feel safe. We don't feel that there's confidentiality there. And I'm sure Alexandra has lots to add.
In my mind, and both Carrielynn and I were part of Can Hep C's blueprint to eliminate hepatitis C. And I think it was a really brilliant piece of work. I am personally quite honored to have been part of it. But in many ways, we approached it the way that Western science typically approaches things. And so, it's all evidence based. And we went to, top clinicians and asked, what are you doing with this? And we went to epidemiologists and whatnot. So it's this very in depth document. But what I really feel is missing is the voice of lived experience. And so, and the wisdom that comes from having lived with things. So for Carrielynn and I, we really wanted to go back and grounded in that perspective. And so we went back to people who had contributed, who had shared their stories and said, this is what we came up with. And their reaction was they finally felt heard. And so that to me said, okay, we've actually done this well. And in some ways, like I've been to meetings on HIV. I've been to meetings on syphilis, hepatitis C. And what I feel people who have lived and living experience of these things keep on saying is, first of all, there's this overwhelming stigma, and it intersects with other stigma and discrimination. So, if I have hepatitis C and I'm Indigenous and I happen to be, let's say, Two Spirit or something, there's all these different layers that are interconnecting. And, what they're saying is that fundamentally, care has to be person centered. And what happens to be my priority right now may or may not be my hepatitis C. It might be, where am I going to sleep today? Or, what food am I going to be getting and stuff. And so they're talking about the need for the healthcare system. And maybe instead of saying healthcare, we should be saying the care system, to really meet people where they're at and, help them to address what their needs are. They'll start maybe being able to say, okay, I've had a success here, I've got that done. Maybe now I can look at my hepatitis C, or other things, right? So a lot of the people that we connected with are the ones that are supposedly hard to reach. And they're like, we're not hard to reach. We're right here. Like, so it's you guys who have to get a little bit more creative about how you're reaching us.
And this is where I want to know, because you looked at 3 provinces, right? You looked at Alberta, at Saskatchewan, at Manitoba. I'm just going to say, I'm here in Saskatchewan. We're most interested about, okay, how does Saskatchewan stack up on any of these fronts in terms of fighting Hep C?
Well, I was going to say, I think you brought up something interesting, Jen, and I just want to hold up my hands to Sadie Harleton, who really was the lead on this one. And then she worked with various people in Manitoba, including those at Ganiginichik, who are one of our partners. And then also with people like HIV Edmonton, I think it is, Carrielynn.
Yes.
And then various people in Saskatchewan. And so I think Carrielynn and I just want to express our gratitude to the work and leadership that Sadie brought to this. And it is with these partners who have trusted relationships with people is how we were able to reach so many people. So again, it's not that we had this, but rather we're working with those who did. You know what I mean?
Yep.
And so then to answer what is different about Saskatchewan, I think there are a lot of similarities across the 3 provinces, and each of them have a lot of strengths. And so I think we want to start with the strengths. And they're doing some really amazing things in different parts of Saskatchewan as well as in Manitoba and Alberta. There are some clinicians or clinical groups that are doing awesome work, and we want to hold our hands up to them.
What kind of awesome work? Like, what do you see? Like, maybe just a small example.
Okay, so there's a group that's called the Wellness Wheel, and they are going out into community and meeting people where they're at. A multi-clinician team, and so you have nurses and physicians. And part of the thing is that they called it the Wellness Wheel because they didn't want to call it the HIV or Hep C clinic, So you're here about your wellness, and they are working with you to deal with your wellness, whatever that might be. So that's like one example. And there's many of these little pockets across the 3 provinces. I'm saying little, sorry, I'm not in any way trying to suggest that what they're doing is small or anything. Some of these can be very large scale, some of them can be very small. It's somebody who has really been stretching themselves to work in a good way with different people, and sometimes without a lot of resources. And so that is, I think, among the strengths, but I'm also speaking to some of the issues. And that is that there aren't necessarily a lot of resources. So you're dealing with fairly fragile systems.
And when you say resources, you mean money and people, right?
Yep, money and people, but also things like, if you think about it, in northern Saskatchewan, we no longer have transportation, bus service, right? So for those of us who are lucky enough to have a car, you really don't think much about maybe hopping in and driving for 5 hours, let's say, or something. But if you don't have a car, how are you getting from northern Saskatchewan down? And so I think that, like, when we're talking about innovative care models and meeting people where they're at, we really have to think about, what does that mean? So The recent government legislative changes, I think, are pretty unique, and so in bringing up mental health and addictions, and they're doing, some really interesting work there. But unfortunately, it means that they have stopped funding a lot of your harm reduction work and education. And we know that this is a gold standard across the world about, like how many needles, let's say, each person who injects drugs should have access to, and, some of the related services and other things. And so if that isn't happening in Saskatchewan, then people are doing the best that they can, but it means that they're probably at increased risk for contracting hepatitis C, possibly again, right? And so those are some of the concerns, I think.
You're right. I mean, with lack of testing, and in some communities, they don't have an RN there, but they have community health representatives there. In Saskatchewan, they are not allowed to do dried blood spot testing. It has to be a doctor or an RN. And so, what do you do there? And people choose not to go into clinics quite often to get tested because of the fear of their status being disclosed. There's a great possibility of people being infected with HIV and hepatitis C, but when they're not getting tested.
Walking around not knowing it.
And when the primary caregiver, doctor for those areas, is not including that as a just an annual checkup routine test, saying I won't test unless I think the person's at risk. Well, how would you know if that person's at risk? Maybe they stopped and helped somebody, and that person was cut, and there was a blood to blood contact because they were putting a bandage on somebody. These are back again to the stigmas and assumptions that people make that are barriers in themselves.
People don't necessarily understand the implications of some policies. And so I remember it's the International Network and Hepatitis Care and Substance Users or something. It's a terrible name, but it doesn't matter. It's a very interesting group of people. And, they were putting forward that often our drug policies are actually what is hurting people much more than the illegal drug supplies. And so when you start really grappling with what does this mean and so on, I think it really helps you to understand the importance of really good evidence-based policy that supports people and meets them where they're at. And, so.
Yeah. Well, and the roadmap is for these health decision makers. You've been bringing it to their attention. You've been at conferences. You've launched it virtually. It feels like people across these three prairie provinces ought to know about it. What happens now?
Well, I mean, it's so funny because when you're in the know, you think everybody should know or does know or something. And the reality is that when you look at the number of people in Manitoba, Saskatchewan, and Alberta, and probably it's a very small percentage who we have reached. And so I think this is one of the things is that we recognize that we really need to be connecting a lot more with people and, trying to explain the importance of an elimination strategy, a micro elimination strategy, different, options on programming and other things, and really trying to help them secure the support that they need. And ideally, not as little pilots, which we tend to do a lot of in this country, but rather as sustained programming that is very much community driven, community centered, because they know what their communities need. And so and I think the other thing that for us is going to be a major piece of work is trying to connect with those decision makers and advocate and, really try to be bringing in some of the recommendations in the roadmap as well as in the blueprint, the areas for change, opportunities for improvement, so that they can be implemented in each of these provinces.
And I think another point, we know that the great mechanisms are, run the considerations of funding and finance and how much you spend on health priorities and what are those priorities. I think maybe the way forward is also going to include demonstrating how you are going to save the healthcare system money by early diagnosis and treating and coming up with a case for that. There's little steps, there's big steps, there's systemic things that need to be addressed, but it's person by person, it's an influencer by influencer, and just the work needs to continue.
In Saskatchewan, in particular, where we have rates that are higher than across the country, Manitoba, I think, is second, but there is such overrepresentation of Indigenous people with hepatitis C, then I think we really need to be supporting Indigenous leadership and self-determination as part of what we're talking about, and that becomes a really critical component.
And there are things that we know that work. For instance, Jen, peer support, where somebody with lived experience who is doing well is able to support somebody that's newly diagnosed and help them walk through the system and the treatments, and be there encouraging and inspiring, because when you're talking to somebody who understands and is living with that, there's a different rapport that someone who doesn't have that cannot achieve. So funding for that, positions and training and funding for training and all of that needs to be put in place. You can't just magically say, okay, so all you people with lived experience that are doing okay, go out there and volunteer and support people. And the organizations don't have the funding to hire a lot of peer mentors who should be part of all of the steps in the strategy, as people with lived experience, but also as those who can train others to be able to support. So it's that whole interconnectedness of what needs to happen. It's not just one thing.
Thank you so much, both of you, for being here.
Thanks for asking. It was great.
Honestly, Jen, it's always such a pleasure to connect with you, so thank you.
Carrielynn Lund is a Métis elder and a researcher, and she was diagnosed with hepatitis C back in the 90s. And as you heard, she didn't seek treatment until almost 20 years later, just because of that dirty feeling, that stigma she experienced when she was first diagnosed. And back then, she believed it was a terminal disease with no cure. Well, Carrielynn has since been treated and cured, as you heard, ever since she's dedicated herself to raising awareness about not just hepatitis C, but a lot of those sexually transmitted and blood-borne infections. She's also a big champion of mental health and to wiping out that dirty feeling, that stigma. So thanks again, Carrielynn. And Dr. Alexandra King's a member of the Nipissing First Nation, and she's an internal medicine specialist who works with patients who are living with HIV, with viral hepatitis, and she co-manages their care. Carrie and Alexandra have worked together for over a decade now, and yes, they teamed up to be the project co-chairs on the Prairie Hepatitis C Roadmap. It was created at the Waniska Centre at the University of Saskatchewan. If you're kind of curious, maybe you want to see it for yourself, go to waniskacentre.ca, and we spell it the Canadian way, so let's start with Waniska, WANISKA Centre, that's CENTRE.ca. You click on Prairie Roadmap to Wellness. Researchers Under the Scope is a presentation of the Office of the Vice Dean of Research at the University of Saskatchewan's College of Medicine. We live and work and created this podcast on Treaty 6 territory in the homeland of the Métis, and we respect our host nations, the ancestors who cared for these lands, and we are committed to Indigenous people across these lands and to establishing right relations, to doing better. You are part of that just by having tuned in and having shared your ears with us. I'm your host, Jen Kinnell. Thanks again for listening to Researchers Under the Scope.